episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, to another episode of the show with another fascinating guest involved in creating a better tomorrow for all of us. Today, we are joined by Dr. Munish Batra, who is a highly respected plastic and reconstructive surgeon with expertise in cranio-facial trauma, burn injuries, upper and lower extremity trauma, and general plastic surgery, and has been honored multiple times as a top doctor in the San Diego area by the local medical society. Dr. Batra started his career as a board-certified general surgeon. He was the chief resident in trauma at St. Luke's Medical Center in Cleveland, Ohio, which is a level 1 trauma center. He went on to do his residency in plastic and reconstructive surgery and did a fellowship in cranio-facial trauma, as well as pediatric plastic surgery and hand surgery. Dr. Batra is the founder of Coastal Medical Group, one of the premier cosmetic surgery practices in Southern California, which manages a variety of patients requiring complex reconstructive procedures for traumatic injuries. In 2004, Dr. Batra trademarked the GBRX procedure in the United States, known as a hallmark of reconstructive surgery for gastric bypass patients. In addition to that work that he's doing, Dr. Batra is also the co-founder of a company called Ospitec, patient and surgical center management technology company, which is revolutionizing the patient experience with a variety of software and technology solutions. He's been featured in a variety of media sources, from People to the Los Angeles Times, been on the Oprah Winfrey Show. And when he's not doing all of that, he is also now a recently published novelist, along with author Keith DeCandido, with his new psychological thriller Animal, which was spawned as a result of being pushed into action by a lot of the animal abuse atrocities he saw when he was traveling the world doing various volunteer work with his medical services. And when he's not doing all of that, well, in addition, he's also working on a nonfiction book called Medical Madness. And in his spare time, he enjoys Brazilian jiu-jitsu, yoga, meditation. Dr. Batra, thank you for taking the time to come on the show and talk to us for a little while.
Yeah, thank you so much for having me, and thank you for your audience for engaging my presence today.
Absolutely, absolutely. We typically start things off by handing our guests the microphone for a little bit, just to talk about themselves, a little bit about your background, sort of, where you grew up, how you got interested in medicine. And it was interesting when I was reading about you offline. I came across a little fact that you weren't really very interested in medicine to begin with. You were interested in being a writer, so things have come full circle in a way. But take us on a little bit of your early journey. That'd be great.
Yeah, so I was actually born in a little village in India, which is a bigger city now, called Kanpur, and we didn't have running water. We didn't have, the amenities, electricity, and things like that. So my first 8 years of life were in Kanpur, and my father was encouraged at that time to leave the country. Because he really didn't have much income, and his brother-in-law said, "Listen, America's opened up." My father's a chemist. Said, they need some people in America that your kids are going to be out here. They're going to not make it. They're going to starve. So go overseas. So my father came to the U.S. in 1970, and of course, as a 6 or 7 year old, I had no idea what happened to my dad. I just know that a couple years later, we were on an airplane for the first time coming to New York, and from New York, we flew into Cleveland. And that's where I settled in for the first 20 years of my life. I grew up in Cleveland, Ohio, grew up in the inner city, and a lot of my experiences in my early childhood was as the minority among the minorities. So I grew up in a black neighborhood. I was the Indian kid, so I was sort of the oddball out. But one thing that my parents always encouraged was education. That's, and that's one of the, I think, underlying traits in Asian Americans, Indians, that, you come to this country, you come to get educated and take advantage of that experience. So when it was time for me I used to work at U.S. Steel through high school, and I thought I was going to end up, being a steel worker. I did well on a college entrance exam, and the guidance counselor said, listen, people in this high school don't really go on to college. We think your son should go on to college. So I ended up going to Ohio State, and my father said, if you're going to go to college, we're not going to, let you. I wanted to be a writer, and he's like, that's not going to happen. He said, you're going to either become a doctor or an engineer. And as Indian immigrants, they really didn't have the autonomy to make a decision. So I ended up following my brother's footsteps, who's a doctor, into medicine. And I realized that one part of medicine that was very creative was plastic surgery. So ultimately, I did my surgical residency, my trauma residency, and went into plastic surgery because of its creative nature. But I never lost that passion for wanting to be a writer. So as you mentioned, full circle, 25 years later, my parents are okay with me going out and doing something I like, which is becoming writing novels, all the while still being a plastic surgeon and being able to make a living.
Outstanding, and you did an excellent job at that. You've built an amazing set of medical practices. You're a top clinician. You were an entrepreneur, and then you begin to travel the world, and you're doing volunteer work in different parts of Asia, and you then encounter mistreatment of animals in a serious way. We've talked a little bit to folks in the past about topics like canned hunting of animals, where they just raise these beautiful lions and so forth just to be shot on a farm. Or we've talked to some of the folks that are doing some of the bat research down in Southeast Asia, and with the current pandemic, enough to say about that. But what did you experience during your travels that turned that light bulb on and said, I have to do something about this. I want to write. I want to do my writing on, and it spawned you to write this thriller, let's say, this novel, focusing on this, let's say, a topic that we need to speak more about.
Yeah. So as you mentioned, I travel around the world, usually end up in disaster areas for humanitarian purposes. So when the tsunami happened, I went to the south coast of India. There got involved with doing some reconstructive work, but also a lot of the work was cleaning up the dead bodies that were there, and putting them on funeral pyres so they wouldn't spread disease, burying things so that it wouldn't get disease. And when the Nepali earthquake happened, me and a group of doctors went to Nepal to do reconstructive work as part of Doctors Without Borders, but also they were out there. But we also have our own society called the American Society of Indian Plastic Surgeons. And we all went out there, and one of the tragic things on that mission was that one of the helicopters crashed and a pediatrician died, as well as 2 other people. So these are, dangerous missions to some degree, but I think all of us have our heart in the right place. But one of the things you recognize, when you go to third world countries, is that, just people are trying to survive. So, how are animals surviving? And if you've ever been to India or some of these countries, there's no, their dogs are, there's stray dogs everywhere, stray animals everywhere. And they're mistreated. But I have my own pet dog at home. So, I have a soft spot for those kinds of things. But one of the things that became really emblazoned in my mind was when I had gone to China and noticed that in the backstreet marketplace, they had carcasses of dogs hanging. And that really left an imprint on me. And, I came to realize that, it's, third world people and animals are surviving, or trying to survive, and they're fighting for survival. But actually, even in the U.S., a lot of this is happening, and it's sort of an underground thing where it's not, as evident. For example, when SeaWorld with the orcas, when I came back from China, blackfish had just come out. And it got me thinking, we live in a modern world here in the U.S., but we're mistreating animals. You see people abusing animals here. You see people abusing the whales at SeaWorld. And then I did a deep dive, and some of the research was just, it was very disturbing. You know, when they went out to get the killer whales, they caught up a bunch of the baby orcas in nets, and basically they died. And in order to hide their carcasses, they stuffed their carcasses with stones, hoping that they would drown. But, you know, they ended up on the surface, and people realized what kind of atrocities were going on. You know, the pandemic has brought out poaching in a more aggressive manner because people aren't there now to protect the elephants and the rhinos and the mountain gorillas. And I think these are all just atrocities. And one of the things that my son Ayan, who's now 7 years old, asked me, which was very moving and deeply philosophical, was, you know, why are these animals going extinct? He's a thoughtful little guy, and they're going extinct because of humans.
Mm-hmm.
You know, we're out there collecting ivory trinkets and, you know, thinking about how beautiful they look, but, you know, an elephant died for that. There's people who use gorilla hands for ashtrays. There's people that are killing the white rhinos for medicinal purposes because of their horns. Those deep questions and those atrocities are what led to me writing this novel, because I thought, you know, yeah, the politicians are trying to do what they try to do. There's organizations trying to do what they try to do. And I just took this to the end of the spectrum and said, what if there was a person out there who was so passionate about defending animals that he became a serial killer that went after people that abuse and torture animals? And that's where this novel came out.
Outstanding, outstanding. You know, I've read that, you know, you've been described as an up-and-coming Michael Crichton related to this book. And like Michael Crichton, he was an MD. He obviously, several of his books, thinking obviously his first book, The Andromeda Strain, which dealt with a killer microbe that the Earth never saw before. He, you know, obviously did Jurassic Parks and genetic engineering. He did some stuff with sort of animal-human sort of hybrid stuff in one of his last books. You're a plastic surgeon. You know all about surgery and cutting and sewing bodies back together. Talk about how this training and your own medical experiences, you know, led to how you crafted sort of the when I say the murders, the psychopaths, whatever in the book. Talk a little bit that, if you would.
Yeah. So for me, it was actually a very delightful journey to some degree. And the reason I say delightful is because a lot of the vengeance that this serial killer exacts on the people that perpetrate these crimes come from my own experience as a trauma surgeon and as a reconstructive surgeon. I was fortunate to have a really good co-writer, Keith DeCandido, who really helped integrate some of those things into the storyline. But if you look at you know, how the scenes open up in this book, when someone is out there poaching elephants and they're removing the tusks from the elephant, what I've done as a cranio-facial surgeon is, you know, I've operated on people who've been at war, who've had faces that are shot off, and I understand the cranio-facial skeleton. So one of the things we do is we use these types of pliers called row forceps, and we put one part inside the nose, one part inside the mouth, and we take a face that's been crushed and sort of break it and disimpact it and pull it back out. And that's what I did to our elephant poachers. I took their midface out because that's what they're doing to the elephant. The people who are skinning the tigers, I skin them alive because you know, part of what I do as a plastic surgeon is harvest skin for grafting and for burn patients, and I realize I understand the science behind it. One of the perpetrators is force-fed until his intestines explode. That's something I saw as a trauma surgeon. Someone who the intestines were so engorged that they literally blew up on the operating room table. So it's a little bit more like Seven in a way, the movie Seven,
Sure.
where, you know, but it's from real life experience. I was a trauma surgeon for many years. I saw the most horrific and was involved in the most horrific trauma settings. At St. Luke's was really known as the Gun and Knife Club in Cleveland, Ohio. We would have 8 to 10 gunshot wounds and knife wounds come in every day. So all of that is reflected upon in this book. The medicine is all very real. The experience to the animals is all very real. It comes from a deep research background into what happens. As Raymond Benson, who's the author of the James Bond novels, read this, and his comment was that the serial killer is actually doing something that is justifiable in many people's eyes. And he does that through my eyes in a way from having done a lot of these things in my own experience.
Let's talk about that a little further, because we're all we're all quarantined now. We have our Amazon Prime and our Netflix, and I'm always amazed when you put aside sort of the organized crime stuff and the Pablo Escobar and the drug cartel stuff. There's an amazing range of shows on serial killers. There's been a lot of stuff done in the past on shows with serial killers that are killing other serial killers, and you feel you don't know who to get behind, but
right.
you don't know if you feel bad about that. But talk a little bit as a physician, as somebody that has taken this oath. Any ethical dilemmas in writing about serial killers to you?
Yeah, so it's interesting you bring that up, because my office staff said, "Hey, we should keep a copy of this up front." I said, "No, I don't think you want to do that in a plastic surgery office." I didn't have any ethical dilemmas, and I recognize that having experienced what I've experienced as a trauma surgeon, having gone overseas and dealt with life and death situations, I'm very comfortable with life and death type situations. I agree to some degree that this comes from the dark recesses of people's minds, but a lot of what we see about serial killer shows is actually based in reality, and we see horrific things happen on a daily basis in our society. So for me, it wasn't a stretch to take what I know in medicine and what I've seen in my overseas trips to the third world and the dark recesses of medicine to pen this novel. Now, I will tell you that one of the books I'm currently working on, called Medical Madness, looks at the dark side of medicine, which is something that no one really is comfortable surveying, and no one really wants to believe that their doctor, which is really probably their most intimate relationship outside of their husband and wife and children, is the patient-doctor relationship. They don't want to believe that doctors have these ethical issues. But every day we'll see doctors that are doing the wrong things. And Medical Madness is about my growth from being a medical student all the way to becoming a trauma surgeon and a plastic surgeon, and looking at some of the ethical dilemmas I faced, seeing patients being operated on that didn't need surgery because, there was going to be reimbursement. Seeing, doctors abusing opioids, which impacted patient care. My own dilemma in saving a patient who had HIV and who had raped a 13-year-old girl, and me thinking to myself, should I have let him go, or should I have intervened and saved his life, which is what I had done. Did I save, and these are deep questions that I think come to physicians' minds but aren't really out there for the public to acknowledge. And I feel that as human beings, physicians, especially surgeons, tend not to be very open with their patients. I can tell you, my patients probably don't see me as a warm and fuzzy guy. They see me as a guy who is there to do the job. And, my staff is warm and fuzzy, so they get some support from them. But my goal is to make that patient better. And I don't, it's hard as a surgeon to express emotion, to express those kinds of things that we tend to keep inside.
I read in some of the materials that the book was recently optioned for a movie, I believe. Can you talk a little bit about what's going on, if it's not confidential, but what's going on there? And then any thoughts on who's going to play you, who's going to play the serial killer? Any ideas on who you'd put in the film?
So I'm not going to be in the movie.
Oh, okay.
But so the movie was optioned and a script was written and prepared by a guy named Tony Eldridge, who owns Lone Tree Productions. They're the movie house that did the Denzel Washington movies, The Equalizer.
Great
so
movies.
movies, yeah. And Tony's currently working on another movie with Benedict Cumberbatch called The War Magician. So he's pretty well known for some of these big studio films. When I had initially thought about writing this novel, the first thing I did was create a synopsis of about 25 pages of what I wanted to have in this novel. And I turned it into something called a treatment. And a treatment is basically something that movie studios are interested in looking at as a synopsis to build a script around. So I did this treatment and I got introduced to Tony through a sound engineer. And Tony said, I've never seen anything like this. It's very unique. And he said, with all the animal lovers in this country, he said, I think this movie will resonate with a lot of people. But he realizes that, studios aren't, they want to play it safe. They don't want to have movies about, serial killers and things like that. So he sees this as an independent film. What his hope is to get someone like Joaquin Phoenix to be involved, who's a very dedicated animal lover. His hope is to have someone like Georgia Fox involved in one of the roles. And we have a Indian actor and an Indian actress lead because the movie is really based on one component of the novel. And the Indian acting lead, he wants to have Dave Patel, the Indian actress. We're looking at several options. But he feels, and he's got a pitch deck together, so he's out there shopping this right now. He feels this will do very well, but it's a movie with a budget of 8 to 10 million, so it's an independent film. But he sees this as a franchise because he feels that, like I said, with the number of people out there who are really animal activists, animal lovers, and this country is becoming, I think, more and more cognizant of, eating better, not eating a lot of the, these fried, meaty foods, that there's going to be an audience for this. So let's, keep my fingers crossed. I'm not going to be in the movie. I'll be on as a writer for the script because I helped prepare the script. But my hope is this, as well as my other novel, which I just finished, which you mentioned, Michael Crichton had done some stuff about hybrids. This novel is about the CRISPR technology and creating designer organs and designer human beings, and it's called Pigman. And that's actually being looked at by Netflix right now. So we'll see what happens.
Very cool. Very cool. I think it'd be cool if you showed up like, Alfred Hitchcock, at least for a couple seconds in a scene, even if it's doing something to the...
I would have a guest shot if it gets made.
Yeah, sweeping the floor.
I'll photobomb the movie somehow.
Yeah. Obviously, Dr. Batra, you do so much. You have the medical practices. You're in the software business. You're writing books. You're making films. You do the yoga and the Brazilian jiu-jitsu, I guess, as your one outlet or your two outlets to relax. Talk a little about these practices and also any other suggestions to the audience, recommendations as a clinician of how we can all relax, de-stress in these extremely stressful times.
Yeah, so this has been the most stressful time for physicians also, as you can imagine. My brother, who's a pulmonologist, works with, in the ICU with COVID patients. He sees people dying. I always pray for him that he does fine. And, I have 3 young children at home, so I have to be cognizant that when I'm out operating on people, that I'm not picking up something and bringing it in home. But really, I think here's the thing I've learned through this difficult time. Number one, to some degree, I'm still, I take all the necessary precautions, and I think most people probably do, but I believe to some degree that fate and luck and destiny have a place to play in this pandemic. I had written something similar to what happened in this pandemic back in 2017. It was called The Prophets of Shiva, and it was about a virus being released onto the world through a human vaccination trial. And it was just republished about 3 months ago by a magazine called Weird Tales, which I don't know if you remember back in the day. It was a very,
Yep.
And it's making a resurgence. But I do think that people are driving each other nuts. I can tell you that people are short-tempered. Everyone's on the edge with everything going on. But I think help is around the corner. And I do think while this may be behind us, there's going to be another challenge. Just like, listen, I was a trauma surgeon in the HIV epidemic. That's one of the reasons I got out of trauma surgery was because I was dealing with these patients with gunshot wounds and knife wounds who all had HIV. And sooner or later, I was going to get a needle stick and realize that, hey, are you putting your life on the line? Things like that are happening in today's world. But the yoga really helps. The meditation is something I've been doing my whole life. I think that's helpful. The Brazilian jiu-jitsu, ever since I tore my rotator cuff, that's been on hold for a little while. So I'm waiting for that to heal. But all these things are outlets. And I think that it's important for all of us to exercise, to take care of ourselves through this. And I think life is going to go on in a different way after all this is over. As a plastic surgeon, I've been really surprised that, and it may be because people are off of work, people are coming in having cosmetic surgery like, I've never seen before. My surgery schedule is booked into February. Now, I do some reconstructive work, I do cosmetic work, and if the hospitals go on bypass, the cosmetic stuff will stop, the elective stuff will stop. But patients are getting things taken care of, they're getting their life back on track, and I think when this is all over, we're going to be in a better place. Things that I used to spend a lot of time going to meetings at night. Now I do all my meetings by Zoom. I get to spend more time with my kids at home. So in some respects, this has been a blessing for me.
Final question. You mentioned early on in your family and sort of the direction you got from your father and so forth. Your son and with the questions about meat and so forth. Talk about, if you would, just some other influencers, mentors, teachers, whatever it may be, that have helped to shape everything that you've done and are going to be continuing to do. And I'll give you the floor for this last part to shout out, to mention anyone you want, please.
Okay, so I would tell you that I feel very blessed and lucky to be where I'm at today, and it wouldn't be there just on my own work ethic. I have a strong work ethic, and I'm motivated, but I've stood on the shoulder of giants, as people would say. My father is a giant. He's the one who gave me this work ethic. Unfortunately, he didn't tell me how to shut it off. But at the age of 81 years old, he still works, and he works in my office doing the accounting, keeps his mind sharp. My siblings have been very supportive. But I would say my wife, my children, they're the focus of my life. All of this is really, as surgeons, sometimes we get carried away. Surgeons in particular, in the field of medicine, a lot of big egos, a lot of narcissism, a lot of megalomania. I've tried to avoid that because, I grew up in a Hindu uh, uh, household. My teachings are through Buddhism and Sikhism and Hinduism. Uh, I I see the world in a very different way than a lot of my colleagues. I would like to say that what I've learned is uh, relationships are more important than materialism. Uh, the people that are in my life that surround me right now are friends that recognize that, yeah, I'm successful, but I'm not one of those guys that likes to show their success or likes to parade their outcomes. Uh, I still want to make an impact on this world outside of medicine. I think I've made an impact in medicine, but a lot of my mentors are people that are not in medicine. They're the spiritual teachers. They're my children. I can tell you that, I got married at the age of 45. I had an arranged marriage. My wife and I met each other one time before we got married. Uh, and first few years of our lives were tough because, as a surgeon, built a certain way, and she was just, this is not, she came over from India. She left her native land to be here with me. And she has been a big influence on me to try to balance my life a little bit. And one of those balances was, I got a pet dog for the first time. And that's how some of this love for animals came to be. She's taught me how to be patient with my kids. I can't treat them like I'm a surgical chief. I have to treat them as, as they're my children, with patience. So I'm still learning. I'm a flawed individual in many respects. And as we are all, but my goal is to be a better human and hopefully leave my children on this planet to be able to fend for themselves, take care of themselves, and be good people, because that's what I want my legacy to be. It's not going to be how many, faces I've reconstructed and how many, I mean, that's all great, but my legacy is going to be my children. So that's who I want to give a shout out to.
Wonderful message. Really appreciate that. Really appreciate that.
Yeah.
Fascinating, we'll say convergent set of things that you're involved in, and really wishing you the best with all of it moving forward. For everybody that's going to be watching on the YouTube channel or listening on the podcast, you've been listening to Dr. Munish Batra, top doc in Southern California, founder of the Coastal Medical Group, co-founder of Ospitec. Look for his books, Animal, soon to be published Medical Madness, other volumes that he's going to be writing. Dr. Batra, thank you for taking the time to come on the schedule, to come on the show and talk to me for a little while and talk to the audience, and just really inspiring stuff, and wishing you the best with it moving forward. Thank you for everything you're doing, and say thank you for making it better tomorrow through your efforts.
No, as I mentioned right at the outset, I appreciate your time and your audience and allowing me to get some of this message out. And, pick up the book. The money's going to go to the San Diego Humane Society, the profits, because, I mean, fortunately, as a plastic surgeon, I do well where I'm not, hoping to make it on my book, but the money will go in the right place, and it'll be on Amazon.com.
Excellent. Excellent. Great seeing you.
Yeah.